Hi, I'm Dr. Seth Riafi, and in this session, we will review the cost, access, and quality issues surrounding healthcare in America. The cost of healthcare in the US means different things to different groups. For example, consumers of healthcare, such as the public, view cost as the price. Now, how much do I have to spend for the physician, hospital stay, prescriptions, insurance, premiums, and other related costs to obtaining healthcare? At the national level, the cost of healthcare refers to how much of our economy is spent on healthcare, which is listed as a percentage of the gross domestic product, or GDP. The third cost definition refers to how much providers have to spend to deliver healthcare, such as suppliers, salaries, equipment, and even the space in which care is delivered. So when you hear the phrase, the cost of healthcare, always understand in which context is this being used. Then you have an appropriate definition based on what context. Trends in healthcare expenditures can be evaluated in three different contexts. The first is to compare medical inflation to general inflation in the economy. This is measured by annual changes in the Consumer Price Index of CPI. Except for a brief period during the late 1970s and early 1980s, this rate remained consistently above the change in CPI. The second trend is to compare changes in the national healthcare expenditures to GDP. Again, the national expenditure of healthcare is consistently above the gross domestic product. This means that healthcare consumes a larger share of the total economic output, which means more of our economic resources are spent on healthcare. Comparing the US expenditures to other countries is the third trend. This chart shows an average cost spent on healthcare per capita. In red is the average cost that first world nations spend, about $3,000 per person. On the far left is the US, which spends an average of $8,000 per person on healthcare. In other words, this all means that the US spends more of its economic resources than any other developed country in healthcare. Here are some reasons why healthcare in the US is more expensive than other developed first world countries. I'll highlight several of them. Healthcare is one of the few services which is not paid for by the consumer. It is reimbursed by third-party payers such as the government, and private insurance. Consequently, the consumer doesn't really know how much his or her procedure, office visit, or hospitalization actually cost. New medical technology is expensive to develop. In addition, USHealthcare uses this to diagnose and treat illnesses and injuries. Compared to Canada and European countries, the US invests far more of its economic resources into technology, research, and development. Due to the rise in life expectancy, more people are living longer. According to data, 2.6 times more healthcare dollars are spent on people aged 65 years and older than younger people. And variations in how patients are diagnosed and treated account for higher healthcare costs. A recent study demonstrated that regional variations in Medicare spending using specialists and inpatient care, but with lower quality, patient satisfaction, and healthcare outcomes. Because we do not have standardization in healthcare across geographic areas and diagnosis codes, this leads to higher healthcare expenditures. So how does the US reduce healthcare costs? Cost containment measures are divided into two categories: regulatory and competition. On the regulatory side, health planning enables policymakers to limit the number of beds and diffusion of expensive technology in order to avoid a monopoly on the supply side. Price and utilization controls are implemented as well. These include limiting Medicare reimbursement rate increases for physician services and medical peer review of utilization and quality of healthcare services. On the competition side, cost control measures include cost sharing, which means that patients, consumers, share the cost of healthcare through co-payments, which leads them to ration their own healthcare. Managed care has helped to control utilization of care and drive down costs through payer competition. Now, let's shift to how patients can access healthcare, which is one of the determinants of health. Access refers to a person's ability to obtain healthcare services when they are needed. There are 5 dimensions to access: availability, accessibility, accommodation, affordability, and acceptability. Availability of healthcare services refers to the match between the service capacity and the individual's requirements. Some examples include sufficient healthcare specialists, social services, and even primary care are available to patients. Accessibility means the fit between the location of providers and patients. Things such as convenience, design, and patient payment options are covered in accessibility. Here's an example of accessibility from a disabled patient. Has this ever happened to you? You call to make an appointment to see a physician and get an appointment for the same week. This is an example of accommodation. Can the patient schedule a timely appointment or receive care within 1 day for acute, non-urgent problems, or 1 week for preventive services and exams? If so, then the healthcare system has accommodated the patient. Can the patient afford to pay for the healthcare service? Affordability includes having the financial resources for co-payments, prescriptions, and even insurance premiums. Acceptability refers to the attitude of patients and providers towards each other. The patient's attitude of acceptability changes whether they perceive that the value is worth it in terms of the patient's perceptions. These 5 dimensions seem fairly vague or ambiguous. So how do we measure access? There are 3 levels of access. The individual level access, which is measured by utilization of services and the patient's assessment of their interaction with the provider. The patient's perceived level of access is tied to patient satisfaction, which means that if the patient perceives a high level of access to services, their satisfaction with those services is high as well. At the health plan level, access includes characteristics of the plan that impact enrollment of patients, such as cost of insurance premiums, co-payments and deductibles, out of plan use and plan practices such as referral services, travel distances, and wait times. At the delivery system level, access accounts for population rather than individual measures. These include policies and programs, ratio of physicians to population, hospital beds per 1,000 population, percentage of households with insurance coverage, and median household income. Now let's focus our attention on the quality of healthcare, which is hard to both define and measure. The Institute of Medicine has defined quality as the degree to which health services by individuals and populations increase the likelihood of desired health outcomes and are consistent with current knowledge. This definition has 5 implications. 1, quality occurs in a continuum ranging from unacceptable to excellent. It focuses on the services provided by the healthcare system rather than the behavior of the patient. Third, quality can be evaluated at the individual patient or the population level. Fourth, it relies on research data to identify services that improve health outcomes. And finally, there are a variety of factors that determine health beyond simply providing services. There are several processes that have demonstrated improvement in healthcare quality when implemented. Clinical or medical practice guidelines are detailed descriptions of preferred clinical procedures for specific conditions. These are scientifically based protocols that guide clinical decisions with the goal of best practice approaches for that health condition. Cost efficiency refers to the benefit being greater than the cost of the service. There are two terms to remember. Overutilization or overuse occurs when the cost of the treatment outweighs the benefit. Over time, the value of this treatment is diluted due to wasted resources and unethical use of care because it deprives others of the benefit of healthcare. Underutilization is the opposite. The benefits actually outweigh the costs, yet the treatment is not used. An example would be how birth weight babies, due to a lack of An example would be how low birth weight babies, due to a lack of prenatal care and low cancer survival rates due to lack of early detection and treatment. Critical pathways are management tools that facilitate interdisciplinary coordination of care. It serves as a plan of action for all disciplines caring for that patient based on the availability of those resources. An example is the team of healthcare providers that treat the spina bifida patient, including primary care, respiratory, neurology, orthopedics, physical therapy, and other healthcare specialties. Risk management includes proactive measures to avoid adverse events such as medical malpractice by incorporating the above three processes in addition to others, such as surveilling the physical environment for hazards and learning from adverse sentinel events by conducting root cause analysis to change practices and behaviors that would lead to similar events. Finally, I would like you to understand how quality is actually reported. Because if an organization doesn't measure and report healthcare quality, then it cannot improve the delivery of services in health outcomes. The Centers for Medicare and Medicare Services, CMS, review indicators for the patients that it covers, the elderly and the poor especially. Initiatives include physician outpatient surgery, electronic prescriptions, and reporting on specific medical diagnostic codes. The Agency for Healthcare Research and Quality, AHRQ, is tasked with improving both inpatient and outpatient quality of care through reporting of a set of quality indicators that measure the quality of processes of care. For example, the consumer assessment of healthcare providers researches the patient experience to determine how that relates to and influence patient care and quality. It surveys items that a consumer can truly assess, such as communication skills of providers and ease of access to services. The goal of this presentation is for you to have a basic understanding of the US healthcare delivery system and how cost, access, and quality are important deliverables, not only from a patient and systems perspective, but also from an economic perspective, given that we spend too much more of our economic resources on healthcare than other developed nations. I am Dr. Wiafi, and thanks for watching.